Over the last 5 years, we've seen a large amount of consolidation in several areas. Hospitals have been consolidating both within the state and across state lines. Medical practices have been consolidating, both using private equity and using independent practice models to consolidate. This consolidation is creating challenges for the radiology practices across the country. We need to learn to work collaboratively as a team across practice lines. If we want to maintain our independence as medical practitioners and protect the best interests of our patients, then we need to innovate. We need to develop tools and we need to develop processes that will help not only ensure the highest quality of medical care to our patients, but also to ensure the vitality of our profession going forward. That's what strategic radiology is doing.
Strategic radiology has played an important role in the quality improvement in all of our groups. Central to those efforts has been the Patient Safety Organization. The importance of having a legally protected, safe environment to exchange important clinical data, quality data, can't be overstated. These data include things like serious safety events and even peer review information. Twice a year, the PSO holds a quality conference, a very popular activity where we exchange best practices among the groups. This is also an opportunity for collegial networking among our growing community of quality professionals. SR's MACRA, MIPS, education and support through the PSO has been very helpful in some of the groups attesting before CMS's quality program.
The founding members of Strategic Radiology realized that they had to do something to provide the same level of after-hours care that was being provided during the daytime. And nobody was really offering that solution at that time. So we decided to take up the challenge of setting up an after-hours reading program. One of the founding members developed the IT platform and we recruited the radiologists that we needed to provide subspecialty coverage around the clock.
We've invested billions of dollars across the U.S. healthcare system in all of this healthcare technology, but we can't share it across each other. At Strategic Radiology, we have a plan to begin to share information across our member sites so that we can be greater than the sum of all our individual parts. The way that we're going to get that interoperability allows each SR member site to connect to each other so that we build a foundation that as new use cases come up, whether it's for teleradiology, whether it's for daytime subspecialty reading, we'll be able to provide that in the future. For example, if one of our sites has extra exams in the musculoskeletal section and they don't have enough to hire a new person, but they need those to be read, they'll be able to go to something we call the Strategic Radiology Marketplace and say that they're open for business, they need some help. And another SR site will be able to start reading those exams for them.
Strategic Radiology brings scale in areas like group purchasing, which might include malpractice, health insurance, benefits, equipment purchases, things that drive down cost for the member groups. Last year, we hit a milestone when we achieved 100% involvement in our accounts receivable database. This allows us now to create cross-member benchmarks and have the data from which our accounts receivable revenue cycle officer will be able to work to achieve significant savings through each member's organization. This effort is aligned with our goal of sustaining the independent practice of radiology.
Clearly, one of the drivers of consolidation in the marketplace is the increasingly burdensome regulatory environment, the cost of compliance. Strategic Radiology has decided to invest in developing compliance services that give our clients access to high-quality compliance tools and resources that represent best practices that can be shared across the SR membership, but at the same time allow for uniquely tailoring them to meet the needs of each individual practice.
Strategic Radiology provides an environment for groups to remain independent. The communication and contacts between our members give a tremendous opportunity for practices to improve performance, and that's backed up by products and services available exclusively to our membership. Joining SR can certainly benefit your practice, but more importantly, it's a statement of your intent to remain independent. These are the types of groups that are joining the growing coalition of strategic radiology.